Just to get us kicked off, let me start off. I'll read Dr. Alejandro Badia's bio, and we'll go from there. So Dr. Badia is an internationally renowned hand and upper limb surgeon. He's founder of Badia Hand to Shoulder Center and Ortho Now, a network of walk-in orthopedic care clinics. Dr. Badia has been in the trenches of healthcare for 30 years. He's a member of multiple national and international professional hand societies and co-founded Mark Institute, one of the largest cadaveric surgical labs in the world. He recently authored the Amazon best-selling book, Healthcare from the Trenches, and is actively engaged in actual healthcare delivery reform. Dr. Badia, awesome having you on the show today.
Thank you, Adam. Real pleasure to be here.
Oh man, so first off, just to get us kicked off, I've been watching you on social media, I've been watching you on LinkedIn, all the other places. I'm like, you are a busy guy. Like, just to date this interview for everybody, this is August 2020, so lots going on in not just the medical field, but in the world. And Dr. Badia, 2 books in 1 year, which we're going to go through these. One that he published with us, and then another awesome work that we help him promote and that we're big fans of over here that I've read, and I think many others show, and we're going to get into this. But first off, Dr. Badia, this idea of healthcare reform, this is the theme that I'm seeing happen in all of your work. So both books and the post, the content that you put out on social media and other places. You're a huge advocate, and like your book says, Healthcare from the Trenches, you're in the trenches day in and day out. So give us kind of an update from your perspective of what's going on right now.
The truth is, not enough is going on. If you look at what's happening now, the DNC is going on, and you notice they're skirting the healthcare issue. When Barack was coming up, he had very strong ideas, and we've even named it after him, right? Obamacare. But I think everyone recognizes now that it certainly hasn't saved money in healthcare. The good thing is it has gotten some people now insured who previously weren't. But other than that, the basic change has not occurred. And this is what it is. We have to get the bureaucrats and even government, quite frankly, kind of out of the way of healthcare. Healthcare is a service, very necessary service, obviously, as we see now during COVID. But it should be between the people delivering the care and the people receiving it. So this should matter to everybody because all of us are potential patients, right? I've been actually taking care of my own couple of health things myself in the last few days. And, we all get to see it from that side. But thus, the clinicians, we deliver this care all the time. And any doctor, nurse, therapist, technician will tell you how cumbersome and difficult it is to deliver that care. It is no longer straightforward. We have to jump through hurdles and hoops to do that. And all of that drives up the cost. So what we're saying, what the book says, Healthcare from the Trenches says, like, have the dialogue with us, the people who are actually delivering the care, so that we can eliminate these barriers. What that will do is it'll actually save so much money that we'll be able to take care of the less fortunate amongst us in society. Because there's no question, there's people at different income levels, but everybody deserves to have good health care. But we need to do it in a way that is economically sound.
No, that's awesome. And I want to take these books and let's just dive into this content. So first off, your chapter in Mission Matters, Business Leaders Edition, volume. I love it. And I think it's going to do some real good for people that read it and kind of take the information back and think about how it plays a role in their lives. Because what I like about your approach to your writing and the way that you presented this material is that you didn't only, normally from the doctor's side of view, like sometimes we're thinking of the more like really heavy medical side or like the this, the that. What you did was you actually kind of went the opposite. You made it approachable. I have exactly 0 hours of medical training, and I could understand like the challenges and the things that you kind of showed in the book and that you showed as opportunity areas really for the overall healthcare system. So first off, the title of your chapter, so where patient care and technology meet, really heavy technology theme in this. Tell us more about this.
Well, what's interesting is that I wrote the chapter before COVID. And yet now I think the public in general realizes that technology, particularly what we're doing right now, which is telemedicine essentially, that we can deliver a lot of care this way. That's incredibly cost effective and eliminates a lot of barriers. So I've been doing that for about 7 or 8 years because about 30% of my practice as an upper limb surgeon, hand, elbow, shoulder, about 30% are people from abroad. And it's much easier for somebody to get on a plane if we already have a treatment plan. So we have the discussion. I can review the studies, their plane films, MRI, ultrasound, nerve studies, all of that I can do with technology. And then obviously I need to put my hand on them, which is a special part of medicine, right? There's no substituting that patient-physician contact, but there's no question we can use technology to facilitate that, which saves time and money. And now with COVID, because of safety issues, we've been forced to embrace telemedicine. So even the public sees it. And I think the numbers, depending on who you read, went somewhere from about 15 to 85% of physicians now have used telemedicine, which is outstanding to get that kind of a bump in literally a matter of months. So it's the timeliness related to the chapter is just sheer coincidence.
Yeah, and the writing was just spot on. So when I read this, I'm like, did you have a crystal ball? Did you have because really it was just spot on in terms of timing. And one of the things that I just kind of, I guess, never understood from my perspective, and not just with telemedicine, but just communicating over things like Zoom, which we're reporting on, or any other thing, is that Skype's been around for, 14 years. So I've been on, we've been having these conversations for a long time, where if you have family or know people abroad, these things have been going on for years. So to see the medical industry kind of embrace this, whether I'm sure that people fall in different categories, not speaking for everybody, but some doctors maybe embraced it in the beginning, some maybe, are forced to embrace it now, but either way you look at it, main thing to me is that patients, especially those that aren't in necessarily areas that have, well built out facilities and they can just drive down the street to their closest emergency center, or they're in a suburb or something like that, your rural areas, now they have access. And I think the access part is a big deal. Can you talk a little bit more about what that looks like?
Well, part of the problem is that we've been slow to engage technology in healthcare. And part of that, I talk about it in the book. I mean, I reference an excellent article from the Harvard Business Review, which basically entitled, "Why is Innovation So Hard in Healthcare?" And the reason is that there's incredible barriers. Bureaucracy. I mean, talk to anybody who, in my case, developing an orthopedic implant to go through the FDA. I mean, it's unbelievably cumbersome. And now, because we're trying to come up with these vaccines, and in fact, I know somebody very well in Moderna, out of Boston, who's really going to be probably the American leader of vaccine preparation. I mean, if you think about what traditionally they would have to go through to bring a drug to market, and it's the same thing with everything in healthcare. So we've been slow to adopt the technology, but again, COVID is going to be a game changer in many industries, many sectors of the economy, but certainly in healthcare. And I think it's going to be a very positive force of change. I mean, unfortunate as it is, of course, we've lost, a lot of people, but, sometimes good things come out of adversity, and we have to at least embrace that. There's no question that healthcare is going to be permanently changed, and in most cases for the better.
Yeah, and I think a lot of industries are going to be changed for the better. And one of the things that I noticed is, getting back to this idea of access and cost, because you're very conscious about what it looks like to get people care, on different levels of the spectrum, whether they could. So, for example, some people maybe can't afford to fly in from out of the country or other places and can't do certain things. So, this kind of thing provides a lot of access for people to be able to really, get the proper care. But I see that same thing happen in the tech sector. Now, obviously, it's not healthcare, but for example, this whole idea of geography bias. So the person that's closest to me is the best person to maybe do the job. So you think about things like, let's say you have to hire a software programmer, I don't know, whatever, random job. And you think, okay, well, who are the software programmers in my town? Let's check it out. Let's see what the, what companies are local that you can work with. Now, who knows? Maybe the software programmer is supposed to be in Russia or Czech Republic. I don't know, somewhere else, or in Europe somewhere, or in Asia. I don't know. But that being said, same thing. It's kind of shrunk the world, in my opinion, to where if you have more of the right people in the right positions doing the right jobs, in theory, and again, this has yet to be seen, but in theory, the speed of innovation should be faster because you have the right people doing the work.
Yes, it should. But in many sectors, there's just an incredible amount of legal hurdles, and I get back to it, bureaucracy. And that's why, many of our software needs are fulfilled in India, where they don't have to jump through all those hoops. And we have to get to that. And, I don't want to be political here at all, but one thing is we got to be sure that whatever administration comes in, that we hope that they can minimize the bureaucracy that is really beginning to stifle this country. And it's gonna set us behind if we're not careful. Certainly it has in healthcare. I can tell you that with multiple anecdotes. It's not just, by the way, it's not just for say new patients or in my own practice. I mean, about my orthopedic walk-in centers. We use this all the time. And you can't see it there, but just last night, I was able to, review x-rays on somebody through an app that we have where the patient comes to ortho now. You can't have, a hand surgeon, a foot and ankle specialist, hip and knee surgeon, a spine surgeon, pediatric ortho, all sitting, waiting when, a lot of things that we get are ankle sprains or back pain that come in. But what happens is we have access to the subspecialists. And just like you need a particular software, a specialist, you can get it remotely. We can now do that in healthcare. The only thing I can't do is lay my hand on that person and, God forbid they need surgery. We can tee that up and get it ready. And many times, the first time I actually meet the patient is, an hour or two before surgery, where I again explain things in person. And I could, at that point, lay my hand upon them. But I already have a plan as to what to do once I've seen, say, the x-ray. And if they shatter their wrist and I have to put a little plate, titanium plate on the distal radius of the wrist, I've already got that teed up. And I could do that in our outpatient center, free of COVID, outside a hospital system, and get them home very efficiently. I mean, there is no substitute for that. And in every portion of a sector of healthcare, we can do that now with technology. And that's what the chapter really tries to point out is there are a lot of technologies that we haven't utilized sufficiently in healthcare. And I think we're going to see more and more of that.
Let's go a little bit further into ortho now, because I don't want to assume, you've been on my other shows before, but we have a different audience that watches the virtual summit. So I don't want to assume they saw your or listened to you on our podcast. I think we've had you on the technology podcast. We've had you on the business podcast. So you're definitely a frequent and welcome guest. But let's go a little bit further into ortho now for those that maybe haven't caught those episodes. So tell us a little bit more about the technology and the mission behind that.
Sure. The premise is that medicine has gotten complex enough that you cannot assume that just because you go to a physician that they're going to know a lot about your particular problem. And I think the best analogy I give people, which they understand, is the eye. I can tell you, I'm a little myopic. I don't even know my own prescription. I know nothing about ophthalmology. Now, I can tell you the anatomy of the eye and the vitreous humor, but if you have an eye problem, you don't want to talk to me, okay? And it's the same thing with orthopedics. And for some reason, the public has somehow been misinformed that they can go to a general urgent care center or even an emergency room and think that busy clinician knows a lot about musculoskeletal care. And they really don't. It's not the place for that. So what Ortho now does is bring the same convenience as a typical urgent care centers that in the last decade have sprouted up everywhere. And for the most part, have been a very good thing, but they don't have expertise in certain areas, whether it be eyes or orthopedics. So what Ortho now does is fill that niche of a specialty urgent care center, which we're going to see more and more of in other fields. Orthopedics is can represent about 30% of visits to a general urgent care center. But I would say the majority of them aren't definitively addressed in that urgent care. They're not astute in making the exact diagnosis. Many times they'll call things a sprain or a strain, when no, there's a much more specific diagnosis, and that portends the treatment. So they don't know how to reduce a fracture and apply a cast. They don't have contact to somebody like me who knows when something needs a plate and screws versus a rod versus pins versus just a cast. So that's what Ortho Now is doing, is filling that niche of the convenience coupled with the expertise. And when you put those two things together, my God, you save an incredible amount of money. And the message I have out there, even in my own community, is that when I see somebody in my office, my hand practice, I can tell you, typically I'm the third, sometimes fourth doctor they've seen, because they go through all these hurdles. And it really doesn't make any sense, because each of those hurdles adds additional cost to the system. And last I looked, healthcare is almost 20% of our GDP. The second highest in the world is Norway at about 10.3%. So we're almost double Norway, which has an excellent healthcare system. And in fact, I did wrist surgery in a small fishing village in Norway with a colleague. So I know what they have, which is excellent care. But there's no reason that we can't provide that care for maybe not half the price, but certainly a lot less than we're spending.
Tell us a little bit more about the functionality. So the technology from the user experience. So from somebody that's out there like, hey, this sounds pretty cool. Like, how does this fit into my world and my healthcare plan? Tell us a little bit about that.
Sure thing. You know, I can even share a screen if you'd like, Adam. Would you want to do that or no?
Let's see if we can. Yeah, let's see if you can do a quick share.
Yeah. So let me go to. I'll just go to the website. So while I do that, so Ortho Now is the website is orthonowcare.com, because that's an important component. And then on that website, it's quite prominent on there, the app, and the app is called the app is called Ortho Now, but the really vital part of it is the On My Way Now feature. So I'll share this now. Okay, you seeing that?
Yep.
Okay, so here's the URL, Ortho Now Care, and we call this section On My Way Now. So what happens is you go to that app, and then you can select the clinic. Okay, so you can find out the closest one, you can find out what their hours are, and then you can let them know that you're coming and estimate a time. And then on top of that, you can now, we partnered with both Uber and more recently Lyft, which I'm actually more of a Lyft proponent. And the fellow, I found out later, is a fellow Cornellian who founded that, Zimmer. And you can actually, within the app, you can call, because if you hurt yourself on a soccer field and you're by yourself, you can't drive yourself with that potential ankle fracture, right? So you can call that, and then you can even send a picture of that ankle injury. You can just use the phone, and now the clinician knows exactly what's happening. The entire team knows, and we can even set up the X-ray machine for an ankle as opposed to a lumbar spine view. So think about the time savings of that. That's almost unheard of. Now I didn't notice we had added Lyft. You can see it here. So the point being is that you can use the app to go directly to an Ortho Now, and we're expecting you. And then within the app, we also have, of course, we have the telemedicine. So if you wanted to communicate, maybe you're quite far away and you want to ask the clinician something, you can do that beforehand. So this is easy to download. Just go to the App Store. We have it both in Android, iOS. It's simply Ortho Now. And we think it's going to be a game changer.
That's awesome. No, I like this. And I mean, I'm a big fan of what you're doing, because you're really creating win-win scenarios is the bottom line. So you're win-win-win. Win for the healthcare system, which let's just say is not the most efficient system we have. Win for the patient, win for the doctors. I mean, it's a win on all different sides in terms of saving costs.
You might say there's a few losers, but I don't consider them losers. you talk to any emergency room and they're overcrowded. They're spending a lot of time seeing things they shouldn't. In fact, one of the founders of, well, he's not a founder, but a co-owner of one of the OrthoNow locations in Miami is an emergency room doctor. And he actually did this because he said he was so frustrated in taking care of people with chest pain or asthma or now COVID. And he's thinking, why is it, Mr. Jones with a ankle swollen like this, sitting on a gurney, on a stretcher for 6 hours? Why? It's not priority. It just isn't, because, compared to somebody with a femur fracture or a heart attack or a stroke, those injuries take a back seat. And now with OrthoNow, that is the priority, and we can let hospitals do really what they should do, which is much more acute and severe type of care.
Let's spend some time on your book. So, Healthcare from the Trenches. We talked about what you wrote for us and for our company. We talked about a little bit more about what you're doing over at OrthoNow. Healthcare from the Trenches really is a deep dive into some of your opinions and views and maybe opportunity areas in the healthcare system. So let's go further along that path. So what really, first off, to get you to the point to finish a book like this, it's not easy. Like, this is a life's work of knowledge. So what was the kind of the impetus for that?
I wrote a chapter. Actually, I'm proud of this because, let me show you. Great to do this from my library, right? So here's a book. This is what started it all. This is an excellent book that readers should take note. It's called Experts in Pink, and it's the Your Guide to Breast Health. So I wrote the chapter on hand and upper limb problems in women and their families coping with breast cancer. And what happened is at one of the events, book reading, I spoke with the person who helped put the book together. And I said, look, I've had this idea for a few years, really born out of frustration. It's not that I was itching to have another task or to write a book. I just felt the story needed to be told. And it turns out that essentially she became the sort of the publisher. Her father is a contributor in the book and is a retired vascular surgeon. And she grew up seeing his frustration, which became very acute in the last decade. He'd been in practice for quite some time. So I engaged somebody who was very interested in the mission of the book, which is simply to explain to the public the challenges and hurdles that all of us clinicians face in trying to deliver that healthcare to the public. And I think the public has to be involved. And even though I offer some solutions, the premise is to raise what the problems are. You can't come up with solutions if you don't know what the issues are. And I don't think the public understands what the issues are. I really don't. Until they run into a roadblock in, say, having a surgery approved or something like that by insurance carrier, they don't realize what we go through every day in the trenches. So what happened is, from that book, Experts in Pink, I engaged her to help me with this book. But what I want to point out is that there are 27 contributors to the book. So it is certainly not just my opinion. Granted, I wrote the bulk of the book.
Fantastic. Well, hey, I know we're about out of time today. I know you're a busy guy. I have patience to see other things going on, but appreciate your time today and appreciate you coming on the show to definitely talk about your book. Well, both your books. You got a lot of things going on here in OrthoNow, so wishing you much continued success for all of us. I want to see that platform grow and continue to prosper because haven't heard anything recently, and I'm trying not to, but if I do, I'd like to be able to use that and to be able to really receive the care quickly and cut down that time and a lot of the other benefits you said. And I like having a guy like you over there in the trenches on this healthcare system. We could spend a year talking about that one, but we're not going to. So again, thank you for coming on this show today. It's been a pleasure. To the audience, hope you're having a lot of fun watching. Stick in for the rest of the season. Got a bunch of other authors that are going to be coming on the show, and we're going to have a lot more great content for you. So, Dr. Badia, thanks again for coming on the show.
Thank you. And I'm really looking forward to learning and gleaning some pearls from my business colleagues in your book. So I look forward to reading the other chapters in the book. And incidentally, for the Healthcare from the Trenches, the website Dr. Badia Book is probably the easiest one. So certainly you can get on Amazon. But if you want to watch a series of videos that talks about the themes in the book, it's Dr. Badia, B-A-D-I-A, drbadiabook.com.